I'm deathly allergic to peanut butter. So come with me as I put some nuts in my mouth. When I was 10 years old, my mother took me to an allergist where I proceeded to get a skin prick test which would determine what exactly I am allergic to. During that test, I was informed that I had a very severe anaphylactic level allergy to peanuts. And since then, I have not put one single nut in my mouth. Until today. Now that I'm entering adulthood and regrettably have the responsibility of setting up my own doctor's appointments, I decided to return to an allergist 10 to 12 years later to determine if I was still allergic, as I found out throughout the years that allergies can come and go. So this time, my allergist decides to run a specific blood test that would let me know which proteins in my blood reacted to specific allergens. And a couple weeks later, he calls me and says, "Sid, I don't think you were ever allergic to peanuts in the first place." Color me surprised, shocked, bamboozled, flabbergasted even, that I have been missing out on peanuts and peanut butter and all things nutty for the last decade of my life. What we're about to do is called a peanut challenge. Now, he did let me know that the blood work is not always 100% accurate, so there is still a chance that I am allergic to peanuts. But he told me to get peanut butter cups, cut them into fourths, and slowly eat a piece and then wait 20 minutes, eat another piece, wait 20 minutes, and then if I can finish 2 peanut butter cups in the span of 2 hours, I am no longer allergic to peanuts. So here it is, and cheers to a new life full of nuts. Okay, it has been 10 minutes and my tongue feels a little bit weird. I'm trying not to be anxious because I am a very anxious person in general, so I could just be making it up in my head, but she's a little itchy. I guess I will be back to give you guys an update. Maybe.
Hi, I'm a board-certified allergist, and I'm going to show you part 2 of that creator's video and then break down for you more nuanced details about the diagnosis of food allergy.
Hi guys, here's the update everybody has been waiting for. We have a lot to unpack. So yesterday I had peanuts for the first time in 10 years after finding out that I actually was not allergic to them this entire time. This was discovered through a blood test, which is a lot more accurate to my knowledge than an allergy prick test, which is one of these. The reason that these can be inaccurate, according to my allergist, is that the allergens are all placed very close together, so an allergy to one may set off the other, and you can also have just skin sensitivities to being pricked or the control or literally anything like that. So I decided to do a blood test, which was very specific and tested the IgE levels in my blood, which are the antibodies that your body builds to peanuts and other allergens. So this was sent to me by my allergist. Once again, I'm not a doctor, but this is a chart that dictates the level of IgE in your blood compared to the level of reaction you would have to the allergen you're being tested for. But it gets even more specific because these H1 through 9 results are the components of a peanut that I have the potential to react to. And if the 0.1 or less result is there, it means that there is little to no chance that I have a reaction. If it's greater than that, then there is a potential reaction. But it matters which one you have a high number to, because you're more likely to have a severe reaction if you have a high H2 allergen than if you have a high H8. The only high level that I have is my H8 allergen, and that signifies that I could have a potential oral reaction or that I'm just allergic to birch pollen. Because oftentimes when you have a birch pollen allergy, which I very much do, it can cause the H8 levels to rise. This is when my doctor called me and gave me 2 options. He said, "Sid, to be honest, I don't think you were ever allergic to peanuts in the first place. If I had to put all my money on it right now, you could eat a peanut and be perfectly fine." That is how confident I am that you could do a peanut challenge at home as long as you have somebody with you who can take you to the hospital if necessary. Or if you're anxious, you can come in and do it here, but I'm not trying to pay the medical bill that it would cost me to make another appointment, so I decided to do it at home because my doctor advised me to. So for everyone saying, "Oh my God, you're faking a peanut allergy for clout, you should not be doing this. Little kids with peanut allergies are going to go home and put peanuts in their mouth." No! I specifically said in the video, my doctor advised me to do this. Thank you. And I'm glad I did, because now I can enjoy a nutter butter cookie, which are now my favorite, in peace. I was also told that I'm no longer allergic to shellfish, so maybe trying that will be my next video.
This creator did a really good job telling her story and giving some general information about food allergy diagnosis. And I'm going to provide some more context to it, some more nuanced information, so that people can get a better understanding of what's going on. Now, I'm not her doctor, so I don't know the context of her story in terms of when she initially got tested and why she got tested, so I'm not here to criticize what that previous doctor was saying, but I'm going to give you some more information that's current and up to date. The gold standard of food allergy diagnosis is actually having somebody eat it, because then you can see if somebody's having clinical symptoms. A traditional food allergy that most people think of, where they need an EpiPen or some other epinephrine autoinjector device, is one where somebody eats the food and then within minutes to maybe an hour or so, they get some pretty severe symptoms, and it could be the following: hives, swelling, problems breathing, wheezing, vomiting, drop in blood pressure, or a combination of these types of symptoms. This is something that's reproducible, meaning every time that you eat the food, you get some form of these symptoms, and it's treated with epinephrine in severe cases called anaphylaxis, or an antihistamine like Zyrtec or Xyzal. I prefer those over Benadryl, which I've talked about in previous videos before. How does somebody develop a food allergy? Well, somehow your immune system has this abnormal immune response one day where your B cells produce antibodies called IgE or immunoglobulin E in a process called sensitization. And then upon subsequent exposure, that food protein could bind to the allergen in another cell called a mast cell, which then degranulates or release all these mediators such as histamine that can create the symptoms that I was talking about previously. When someone gets an allergy skin test or a blood test, we are trying to measure the specific allergy antibody that could bind to the protein. So what we're measuring is that word sensitization. We're not actually measuring the word allergy. Allergy is that abnormal immune response. So sometimes you could have these antibodies that show up on the test, but not actually have a reaction. This is why context matters in terms of what was actually going on when getting that type of testing. Did the test actually answer the question that we're looking for? I don't know in this creator's situation, but it's a very nuanced piece of information that people need to understand why it's important not to just get tests just to get tests. So like this creator was mentioning with the skin test, it can be very inaccurate if you're just getting the test to get the test. You can have a lot of false positive tests, meaning the test says it's positive, you think you have the disease when you don't. What's good about a skin test is that if the test is negative, it's a higher likelihood that it's truly negative compared to a blood test. Now let's go back to that blood test that the creator was showing. This is a peanut allergy panel looking at the total peanut allergy that an antibody could bind to, which actually was positive. And then we have these other numbers here that are called component resolved diagnostics, meaning we could take that peanut allergy protein and see where the antibody could bind to specifically on that protein, and it gives you different pieces of information. So when we look at this test, this is shorthand for Latin, the genus and species for peanut, which is Arachis hypogea, and the number is just the order of which that protein was specifically discovered. Blood tests only tell you the risks of having a reaction. It has nothing to do with the type of severity of a reaction. So the ARAH2, which is listed up here, is the most specific one to show you that there's potentially a systemic reaction there, but it doesn't necessarily mean that the next time you eat it, you could have a severe allergic reaction. Since ARAH2 was undetectable and we have levels for 8, that is sensitive for something called oral allergy syndrome, where your immune system is confused into thinking that the peanut protein looks like that of birch tree pollen. So when you eat it, as the creator did in the first part of the video, she was complaining of some itching. That is an oral allergy response, and one that does not usually require epinephrine. You'd be surprised how many people have oral allergy syndrome, which is where you get tingling or itching in your mouth when you eat fresh fruits or vegetables, and sometimes peanut and tree nuts, and actually have a pretty severe pollen allergy. So some take-home points here is that it's always important that whenever you get any type of testing, whether it's food allergy or otherwise, you should always ask your physician why they're getting the tests, what are the risks and benefits of that test, and how accurate is that test. Also, if you have a food allergy diagnosis and you haven't seen an allergist in many years, it's a good idea to see one, because you never know if that issue has resolved or maybe there was an accidental misdiagnosis. If you found this information useful, feel free to hit the like button, the follow button, and add a comment to let me know your thoughts. And have a great day.